Thank you all for joining us here this evening for Breaking Tradition with Class IIs. My name is Kevin Wahlberg, and I'm with Garrison Dental Solutions. I'll be helping out a little bit this evening, but the real star of the show here is Dr. James Braun, our presenter. Dr. Braun is a fellow Michigander. He's over on the other side of the state. We're in West Michigan, and he is on the exact opposite side of the state in Saginaw in East Michigan. And he's been a very good friend of Garrison Dental for quite a few years now. He's done everything from advise us on new product concepts, testing new products. He's taught a couple of CE courses over at our facility in Spring Lake. He is a nationally recognized speaker and a top presenter at both the state and national dental events. And he's going to have some really good information for you this evening, and is going to be very happy at the end of the presentation to answer your questions. You should have a chat box or question mark someplace on your screen where you can submit those questions. We'll collect them and get them ready for Dr. Braun, and he'll be able to answer those at the end. So without any further delay, here's Dr. Jim Braun.
Great. Thanks, Kevin. I'd like to thank everybody for tuning in tonight. This is some really interesting, exciting material we're going to be talking about tonight. I appreciate being sponsored by Garrison. Besides some of the courses that Kevin mentioned, we've done a number of workshops like at the ADA focusing on the utilization of a lot of their matrix systems and products for the placement of composite restoration. So this is fun. We have some new products to showcase tonight. One thing about Garrison that's certainly true is that they're very innovative, coming out with new products, and I really think they've reached a plateau with a lot of these new products and continue to improve on it year after year. The theme tonight is going to be on restorative products to help ensure predictable success when placing posterior composite restorations. The enjoyment and satisfaction coming with that particular approach, and feeling that you've a job well done when everything is completed. And a main portion of that particular procedure is the use of premier products. So the use of Garrison products, you'll see, will come to the surface here and realize the importance when you talk about placing composite restoration of the posterior, which sometimes can be rather daunting. So I really appreciate the opportunity to work with Garrison. I'd like also to thank Brian and Kevin and Jason and Marcia for helping with the success of this particular webinar. Garrison's been around for well over 20 years. I've been working with them for a long time. It's just fun to see how they've evolved and how they've improved our clinical dentistry. So the title of this particular presentation is dealing with posterior composites. You know, things have changed certainly over the years. Composite is a different type of material, different type of restorative procedure than what we've had to do when we've utilized amalgam. So we have to understand that we need particular and special products to ensure success, cut down the stress, and know that we're doing the right procedures for our patients. Here are some of the topics that we'll be talking about tonight, and some of these will be a little bit more in a minor role, but all these components and topics that you see tonight are integral and extremely important in the success when we talk about restorative procedures with posterior composites. But our focus will be on the matrices and how they help improve our dentistry. So that's my mission tonight. I want you to go ahead and take and glean as much as you can from this. If you need to get a hold of me in the future, certainly contact information is available. If you have any questions tonight, we'll certainly address as many as we can. But my mission is to help improve your clinical dentistry and give you insight into premier products and help you really enjoy this facet in artistry in dentistry. You know, if we look at some of the facts and figures that we're dealing with currently, and these are kind of a summation of what's going on in the industry. 80% of our direct restorative procedures are composites. You know how that's changed over the last 10 to 20 years. And 80% out of those direct composites are posterior. So there's a real dominance of that particular restorative procedure. Obviously, replacing old amalgam, need to go ahead and do restorative procedures, recurrent caries, wherever the case may be. And amalgam use, we know, is down. It's certainly a viable product. It's still endorsed by the ADA, and still something which will continue to be benefit to many people in many areas of the country. The other fact that's kind of interesting to note, that of our posterior composites, approximately 45% of those involve Class IIs. So being a matrix company, this is really a key factor to know. There's a wide range of opportunity out there to take advantage of these products because it's such a commonplace procedure. One thing that I want to mention, a few products which I think are generally extremely important and necessary anytime we're doing restorative procedures. One is a intraoral video camera to go ahead and depict to our patients needs, fractured amalgams, discoloration, recurrent caries, whatever the case would be, fractures. This goes without saying, we use this for all our restorative procedures. We'll talk about time and time again, restorative dentistry has to be done with magnification, and having this this orange filter is extremely important. You have to have it as a necessity. We talked about using light-cured materials, how important it is to have that available to prevent premature polymerization. Of course, LED magnification, 3-watt LED light is also integral. The other thing which I'll show you now, and you'll see how important it is the use of electric handpiece, not only for preparation, for doing the finishing and polishing, reducing the torque, reducing the decibel level. It's such a wonderful piece of equipment to use, controlling the RPM, the heat production, vibration, so much more improved in the precision involved. Notice the 5,000 RPM and everything as we get into finishing and polishing. Of course, these are all LED and water, air spray, and these can be easily connected to your air turbine handpiece. The other thing we use all the time is a 3-watt soft tissue diode laser. This was from AMD. The handpiece I showed you is a Brassler handpiece. These are products that I purchased. This we use all the time for removal of soft tissue, not only for crown and bridge, but also for doing composite procedures such as Class 5s, Class 2s, Class 6s, where you have tissue impingement, interdental papilla issues we have to deal with. This is another extremely important piece of equipment to have in our armamentarium when we talk about any type of restorative procedures. And it really allows us to gain access to very deep subsulcular cervical areas that otherwise would be very challenging to gain access to. As we take a look at composites versus amalgam, we know amalgam use is down. If you look at various studies over the years, they fare comparably as far as failure rates and tendency to replace. Composites are actually starting to show even better promise in the amalgam. And this is just a Medline compendium study, kind of a collection of various studies indicating that the efficacy and the resounding success of these composites. And now with these new 7th generation adhesives and nanoparticle composites, this will continue to evolve and become even better as we go through the years. Some of the issues that we face when it comes to composite placement, it's different than amalgam. We cannot carve composite. We have to have it well adapted. We have something which is going to prevent microleakage, which looks great. It's going to hold up for years and years without breakdown. So we have to be mindful of interproximal contacts because we cannot compress it like we can in the same manner we can amalgam. Finishing and polishing, we can't carve it away, can't sculpt as easily. Sensitivity can be an issue. We'll talk about that, how to avoid that, and longevity. One thing that you'll find as we go through these procedures, if you're not using sectional matrices, it makes such a world of difference in the improved interproximal contact, reduce of any excessive interproximal flare and composite, and also cervical issues, getting a maximum seal down in the very deepest part of the box. Why sectional matrices? This is just a little schematic to give you an idea. Being the fact that we cannot carve and have the ability to do that with composites, we have to have some type of matrix container that will allow the best optimum contours based on the natural anatomy of the tooth structure restoring. Unfortunately, when you utilize Tafelmayer bands, it's more of a circular approach, so you have much greater tendency to have an extension, excessive composite. You have to finish and polish, and a lot of times that can be done down the cervical. It's really impossible. So you want to start out and be able to reduce that or minimize that or eliminate that completely if you have a properly contoured matrix. And sectional matrices are certainly the answer from that standpoint. And you'll find these bands we use are so thin in the wedges, there's absolutely no problem whatsoever of giving good interproximal contact. These are just an example of a Tafelmeyer. You can see some of the issues that we can end up with trying to place composite, not only down the cervical, but the flare of our isthmus there, and the ability to have it more over contoured, then having the daunting task of trying to go ahead and doing the finishing and polishing. It makes for a very difficult procedure. The contours are abnormal, and it's challenging to go ahead and end up with a really proper tooth position, tooth located type of interproximal contact, and the topography and anatomy we desire. That's why we like to use these matrix. And you'll see as we go through this, the step-by-step procedures, being able to go ahead and hug the tooth we're preparing with these sectional matrices, sealing off the interproximal walls completely and the cervical part with the matrix and the wedges, end up with this beautiful, well-adapted restoration, which minimizes our work when it comes to finishing and polishing. Another example just showing it, how beautiful these can be, and we'll talk a little bit about some of the composites available and where I'm at right now. We'll talk a little bit about bulk fill when it comes to posterior composites. And you end up with this beautiful, nice interproximal contact, perfect floss contact, snaps through the interproximal contact, no overextensions, no lateral extensions, end up with just a beautiful, well-configured restoration. Some of the things that we have to think about when we talk about addressing the challenges of placement of composites, all these factors that you see here go into that final success. It's not just the best adhesive or composites, the matrix system, and then I'll show you my method of finishing and polishing. I've really tried to simplify it and end up with just a gorgeous, enviable restoration and utilizing the fewest amount of steps and equipment. The matrix system is certainly something that we're going to focus on tonight. Garrison's system is premier. They've won awards year after year for the introduction of very novel and avant-garde equipment, and it's just a real enjoyable procedure to work with these products and predictable. Just as an overview, anytime we do posterior composites, interproximal composites, these are the following components that we need. We have to have an LED curing light. We have to have some type of adhesive, some type of composite, some type of matrix system. And you'll see how this evolves as in the following cases. These are the rudimentary pieces of equipment we need to go ahead and place these predictably time and time again. Starting with our adhesives, I'll show you where you should be at right now. We talk about eliminating post-operative sensitivity, gaining maximum adhesion both to the enamel and to the dentin, and having no issues as far as micro leakage down the road. These are all representations of 7th generation adhesives, which are really the way to go with these self-etch adhesives, and we'll talk about the application and why they're so valuable. The other thing we have to be mindful of is composites. What type of composites do you need? You know, how extensive the kit, the handling characteristics, the reputation of the manufacturer. You know, how extensive the kit you need. You need modifiers. I've seen over the years how a lot of these kits have been really reduced down to maybe 6 or 8 shades and much more simplified to use instead of having a multi-layer buildup. Most often, especially with the bulk fills, one shade really will satisfy this. And the nanoparticles or nanohybrids are really universal composites, for both the anterior and posterior, are beautiful. They're gorgeous. They're durable, very abrasion resistant, polish extremely well, handle well, and just really the best thing on the market. And I'll show you as we go on which products I'm specifically using and why. We also have to have a matrix system. This happens to be the Garrison 3D, and we'll show that in some cases, and also the new XDR, which is even a more taut type of ring system, and some of the new matrix systems and the new wedges, which are really, really incredible what they've done to improve that I really give them a lot of credit. And of course, our composite placement instrument that we use is multifunctional, has 5 different functions, has blades and has the pluggers there, has an acorn for sculpting. So it offers us everything in one product and really reduces the armamentarium, which makes it easy to understand. And we'll also talk about finishing and polishing and how I've evolved over the years. And I'll show you my current thinking and why. And I really got this thing, I think, down to a science. No matter where the restoration is, whether it's a Class 1 through a Class 4, what products to use and why, and how some of these new polishing systems can really refine a beautiful reproduction of natural anatomy and give us a lasting luster to these, and simplifying the ability to go ahead and end up with that enviable result. Some of these facts that I mentioned here, I just kind of want to outline as we go through the actual procedures here, that what we have right now with the 7th generation and these nano hybrids materials really offer us the best of anything we've had over the years, and they really allow us the confidence and capability of placing these, knowing the patient's going to go home and not call you up the next week and say, you know, that restoration you placed, that filling you put in there, it still hurts when I bite down. What went wrong? How can we avoid that? As we get into the application of the adhesive, you'll see that. This is where we'd like to end up. This is a end result I strive for, we all strive for. A beautiful DO on tooth number 29, a pristine tooth, had some caries that had to be addressed. But look at the magnificent polish, the configuration, the ability to go ahead and blend into the natural dentition and end up with this interproximal configuration there. No overhangs, no overextensions, laterally that would require a lot of finishing and polishing, and something which is going to last hopefully for decades. These materials are so predictable and dependable that you can really have a confidence with them. Usually during the first 5 years, if there is any type of failure within these restorations, maybe some type of chipping or fracturing, and after that it's usually recurrent caries. So the need to go ahead and reduce and eliminate micro leakage is really critical, not just with adhesives, getting a very sincere and sound seal to that cervical portion, prevent problems of bacterial accumulation, plaque, inability for that patient to go ahead and clean properly, and the potential for recurrent caries is negated completely. Another example just showing how beautiful these restorations are, replacing a DO on tooth number 4, an old amalgam. Now I don't recommend, I never have the wholesale replacement of sound amalgam. You know, if it's a good solid restoration, the patient's having no problems, no radiographic indication replacement, leave well enough alone. Every once in a while, if there's a real aesthetic issue, tooth number 5 or 12, maybe we'll replace something that's very conspicuous. But that's a very, very small percentage of times. We replace these old amalgams with this breakdown, recurrent caries, sensitivity issues that would indicate the need to go and replace them. And of course, our option is to replace it with the composite. You know, look at the biology and how the matrix is able to go ahead and capture the contours of that tooth, extend it over to the first molar there, and end up with this nice interproximal contact. Easy for the patient to clean and maintain. And look at the luster and polish that these nano composites acquire when we're done with all these procedures. Another example, this is a little bit more of a step-by-step. The first molar there, a multi-surface. These are some of the original older composites that were placed. You can see you get obviously a lot of wear that had taken place, breakdown, things like that. We're going to go ahead and replace the composite, the old failing composite on tooth number 3, and just show some general approaches with some of the materials. And then we'll get into the more specifics as we go along. And this is where the Garrison products really come in handy from a standpoint of these larger restorations, molars, something that requires a little bit more effort, a little bit more attention to occlusion, especially larger ones like this. We have to have a matrix band, the forceps, the wedges, the rings that will allow us the ability to place these soundly and satisfy all the needs of restorative procedures. and end up with a product we know is going to last and the patient's not going to have any problems with. And this is just kind of a step-by-step here, and then we'll get into a few more cases that outline various other products and procedures. So first thing we do after we remove the old composite is we're going to start with our adhesive step. And I'll show you, as in later cases too, the following recommendations of a selective edge is certainly the way to go, and these self-etch adhesives are also the way to go, eliminating really post-operative sensitivity, reducing protease enzyme creation for breakdown, micro leakage down the road, and really something which is much more predictable because of the nature of being more forgiving as far as moisture content. Too desiccated, a little bit too much moisture really doesn't matter with the bond strength. So we're going to go ahead and scrub this in the tooth for 20 seconds. We're going to go ahead and air dry it for about 10 seconds or so. And now we're going to go through, and this is what we'd like to see, the ability for that adhesive to penetrate the self-etch adhesive. Gently removes about 10 microns of hydroxyapatite, which is surrounded by obviously the collagen fibrils and the dentinal tubules. We'd like to go ahead and fill in this void or this vacuum with our adhesive, and these are all based on bis-GMA and activated by the CPQ camphor-quinol, which activates the free radicals to form the amines and starts a polymerization process. But this, we'd like to see a complete seal and hybridization to prevent and eliminate micro leakage. So we're going to go ahead and cure this with our LED. A lot of these are like 1200 milliwatts. We're going to go ahead, all you need is 10 seconds. Get as close as you can to the restoration. 6 millimeters away, you lose half of your energy. So these LEDs are certainly the way to go. That's why, because they're completely coordinated with the wavelength that activates the CPQ, about 460 nanometers. Much better than we can get with our halogens, so we're much more energy efficient, accounting for about 80% of absorption of that energy because of the CPQ being activated at that light wavelength. And now we're going to go ahead and we place our matrix in there. This is they're about 1/1000th of an inch thick, and you'll see it has a special non-stick surface on there, which was invented by Garrison. And then you can see our wedge which was placed right there. Now we placed on our ring. Go back one there. Went forward on me. We're going to go ahead, we placed our ring on there, which also spreads the teeth apart a little bit more. So now we have really a tenacious grab onto that matrix, and we separated the teeth. Now we're going to go ahead using our multifunctional instrument. We're going to go ahead and compress this, place this into the box first. If you're doing a multi-layer buildup or a 2-layer buildup, we're going to place a couple millimeters into the box first, fill it up a couple millimeters, cure that, and go on, and eventually end up with our enamel shade. This is the layered concept, and it's a very beautiful way of doing it. You'll see with using the bulk fill, this kind of eliminates some of the steps and some of the potential errors and incorporating some flaws and defects when you're starting to build it up. Getting homogeneous buildup of that particular restoration. This multifunctional instrument is a nickel-plated titanium instrument and offers all the ability with 3 instruments with just in one. So it really is a wonderful instrument to use. And then finally the buildup and final curing of 20 seconds of our restoration. Now we're going to go ahead and remove the ring and sectional matrix and our wedge. Do our finishing and polishing. I'll talk about that. When this was done a few years ago, I was using fine diamonds, extra fine diamonds. Fine diamonds were 45 micron grit. Extra fine are about 15 or so, 20, and you'll see how I've changed and improved on this approach. Back then, this was a nice way of going ahead and reducing some of the excess composite, adjusting the occlusion. It's a little bit easier to do it with some of the fluted carbides you'll see, and less potential negatory effects on the enamel. Then we finally do our polishing. You can see we're starting to gain new luster. We've checked our occlusion. Notice some of the hemorrhaging that creates when we put these wedges in. You'll see the new one that really eliminates that. You always get some bleeding, the interdental papillus and trauma that takes place when you place these wedges in. The new one eliminates that, which is really nice. And then our final restoration. So by the use of the nano hybrid 7th generation adhesives, the 3D ring set, the matrix from Garrison, we end up with this beautiful, really well carved and sculpted restoration with a minimum of finishing and polishing, creating that beautiful interproximal design. So let's take a little bit, let's evolve this a little bit more in some of the products that we build upon and show you some opportunity to go ahead and introduce you to some products which are in their particular way an improvement over what we've had before, but certainly based on the same principle. So in this case, and we'll talk a little bit about some of the need to go ahead and adjust the matrix too. We're going to go ahead and place on tooth number 4 there, a DO. There's some caries there, interproximal caries. And so we're going to go ahead and open that up and go through a few of the steps here that will allow you a little bit better insight into these procedures. And this we're going to talk about our 7th generation adhesive. And I use Scotch Bond Universal. It's the #1 selling adhesive from 3M Oral Care in North America. You look study after study in how predictable it is. It's a one bottle, one application. The adhesive, we don't have to mix a primer and adhesive together. The dental surface moisture is not critical. Post-operative sensitivity is eliminated. And it bonds to dentin 25-30 megapascals. We'll talk about selective etch and then the self-etch on dentin, and there's a lot of rationale for using it that way and still getting similar, if not better, bond to dentin by using the self-etch portion on the dentin. The pH of phosphoric acid is about 1. The self-etch Scotch Bond is about 2.7, so that's where we have to go ahead and consider the use of selective etch. So after we've done our preparation, we're going to go ahead and take our adhesive. As I mentioned, we're going to scrub it in there for 20 seconds, allow complete impregnation of that particular dentinal surface with our adhesive. Scrub it, make sure it infiltrates properly in there. We're going to thin it out with our triplex, and this is what we're trying to establish, is this hybrid layer, and that's what creates the problems of post-operative sensitivity. If you indeed do not seal that area off, you get potential of moisture and water creeping into the dentinal tubules. It's not the bacterial remnants that creates the sensitivity. It's the fact these dentinal tubules are not occluded properly. And so what happens when the patient functions on there, this water is driven into the dentinal tubules, the odontoblastic process is stimulated, and you get pain. So that's why if we can establish this very sound and very predictable hybrid layer that you see there between the dentin and the composite, so that we do not have that infiltration, we will eliminate the micro leakage and negate completely the problems of post-operative sensitivity. So that's why it's important these self-etch adhesives allow us to do that in more in a predictable manner than what we get with our total etch on the dentin. So we're going to air dry for 10 seconds, and this is where we're going to employ the use of the, we showed you before the 3D ring. There's also the Composi-TIght, this Garrison product, the 3D XR, which is even more taut. It's got this beautiful silicone interface and this little nylon interdental extension there, which allows a really sound and very, very strong compression onto that tooth, and with our matrix allows us a beautiful opportunity to get the really enviable interproximal contact. And these are easy to place. You use their forceps, and you'll find out they stay on. They don't, spring off, or they don't move on because they're so taut. Much better than any of the other ones I've seen on the market. So now we're placing that on. You can see the ring comes from the mesial, obviously for access and removing it on and off, and for eliminate the problems if you were to place it the other way around towards the posterior. But what I'm doing here is burnishing the matrix. What that allows us, after we placed our matrix, we centered it, we placed our wedge in, now we placed our ring to go ahead and subdue everything and connect everything and to stabilize everything. But even so, during this process, you know, as things move around a little bit, there's potential, and you'll see with the new matrix system, it's probably eliminated a great degree, but there's always potential for a little that, for some of that that matrix to move a little bit. So we shimmied up just by taking our instrument, once again, burnishing up the interproximal context. Now we know we have very sincere contact there. The tooth is wedged apart and the ring keeps everything in place. Now we're ready to go ahead and do our bulk fill, which I'll show you a little bit more about as we move forward. This is a one-step, one-shade application, filling up the entire restoration, the entire cavity preparation in one fell swoop. And with these new materials, you're guaranteed you're going to get complete polymerization up to 5 millimeters. And this really, it undergoes a little shear, and this is the 3M bulk fill. I'll give you a little more information on it. But it ensures a complete infiltration into that preparation, filling it up completely, no potential for voids or flaws or any types of issues from a standpoint of having a very homogeneous material in there. It certainly takes less time. So we're going to go ahead and place that on. Now we're doing our finishing and polishing. You can see once again some interdental hemorrhaging because of the papilla trauma. But I'll show you as we get into this a little bit the specific materials that we use for finishing and polishing. And I've really spent a lot of time trying to determine what's the best way with the fewest numbers and materials to finish and polish these. We can't sculpt it and carve it like we can amalgam. It's a different animal. We want to have good morphology, good interproximal context, proper occlusion. We don't want overextensions. We want to have proper finish line relative to the preparation. And this is a fluted carbide, and the numbers will be evident what they are and why. And this is what these once again are from Brassler. The numbers will be shown towards the end of this presentation, but you can see that and this covers every type of restoration you can imagine. We have the acorn shape, the 15 fluted, which is on yellow, and the 30 fluted. These are fluted carbides, and then we have the same thing with our flame shape for any proximal issues or facial issues we want to deal with. But this acorn shape allows us, unlike the more egg shape, we do not have a negative effect, a removal of excessive composite, and end up with a loss of cuspal support and cuspal morphology because of that. This works out perfectly on the cuspal incline because of its shape and does a wonderful job. So you can see what we have now. Start out with, we have essentially, and I'll show you the wheels we do for polishing. We have essentially 2 steps for the occlusal and finishing and polishing that are polishing. And these are the wheels that I'll show you. Once again, these are from 3M. These spiral wheels fit in every part of every anatomy you can think about, from Class 5s, 1, 2 through 6, because of the fact that they have the ability to polish and follow any morphology that you have present. It's really the way to go and maintains the integrity of that restoration without degrading it. This is one that was out about a year ago. I'll show you the newer ones that are out. Luminous oxides impregnated in these wheels, and the newer ones are reusable. It can be autoclaved, used up to probably 4 times. These were disposable at the time. You can see the nice restoration we ended up with and the nice contact. Let's take another example here and extend this a little bit for Class 6s. And this is on tooth number 13. You can see 12 needs some help too, but we'll focus on number 13. And one way that you can really ensure, especially it's more important when you have adjacent virgin teeth, these fender wedges, these are from Garrison. They allow a little stainless steel wedge or a little stainless steel wall there, will prevent you nicking the adjacent tooth, and also starts in some of the pre-wedging of that particular restoration. And these come in 5 or 6 different sizes, I think. So these are really nice if you want to avoid nicking the adjacent teeth inadvertently, iatrogenically. This really works out well to ensure that. So we'll go ahead. This is where I mentioned the selective etch on the enamel only. You only need to place it on there for 20 seconds. That's certainly the way to go because of the pH present. And we're going to go ahead and then place our 7th generation adhesive on the dentin and on the enamel for 20 seconds, scrub it. We're going to go ahead and light cure it. This is the Deep Cure LED from 3M Oral Care, wonderful LED. Go ahead and light cure that 10 seconds for the adhesive layer is all you need. Obviously, we haven't placed the matrix on there yet. We've done everything else to go ahead and ensure the validity of that hybrid zone using that selective etch approach. Here's some of the problems. If you don't thoroughly light cure these products, you end up with micro leakage, incomplete polymerization, problems of micro leakage leading to caries, different things relative to that, stain, discoloration, irritation of the pulp. So get a thorough cure. Make sure you completely coat your internal cavity preparation, the walls and the cervical box extremely well to ensure that application mode. Now we placed our rings on. That's the XDR that I'm showing you there. When you place these, you put the mesial one on first, which may be kind of hard to see. It's the one over here. This one, that one's placed first. Then we place our secondary one. We put our matrix in, then our wedge, and then put our two rings on. It works out very well. And then we can go ahead. You can see we're using the bulk fill. It's a one shade kind of approach. And this is just some literature, nomenclature relative to this type of material. You know, they look great. They cure. It's just like the typical Filtech Supreme Ultra. This is just the bulk fill. It's got a little different, same chemistry, same physical nature to it, but it's just got a little bit more translucency and the ability to, as polymerization takes place, the ability to resist problems of inadequate adhesion because of its bulk fill nature. It has special monomers in that resist that as shrinkage takes place in a bulk form. And this, once again, the attributes of the bulk fill goes without saying. It's invented by 3M Oral Care over 10 years ago, and it holds up extremely well. They've done thousands and thousands of teeth prepared and placed with these materials in the Scotch-Bond. How well it holds up, how well it maintains the polish, the integrity, the lack of chipping and fracture, and really something you can count on time and time again. High compressive strength. And these nano clusters are really unique to that particular chemistry. Nano is 10 to the negative ninth meters, infinitesimally small. So these particles are extremely useful when we talk about placement of composites, resist plucking and changes that take place on the surface. So now we're using, once again, our multifunctional instrument to place this. Go ahead and moving around, sculpting to make sure it's compressed properly. The line angles and the cuspal inclines and the isthmus, the marginal ridge at the proper height. Then we'll go ahead and light cure this. Now this is done. Also, I don't show it here just because of the time constraints. Once you would cure it from the occlusal, you'd also remove the bands and cure it interproximally on the buccal and the lingual. And this is at the time, a year or so ago, our finishing and polishing. You can see the acorns there. These are from Brasser. The polishing spiral wheels you see are from 3M, and I'll show you the newer version, which is out and really work out better. These were disposable at the time. So we're doing our finishing and polishing. We start out with the 15 fluted. Does a nice job of carving back the anatomy, any overextensions, adjusting the occlusion, and you can see due to its shape, it does not reduce the overall anatomy of that occlusal form. Egg-shaped wood, this acorn does not. So this is step number one. Step number two would be following it through with a 30 fluid. It prepares that surface for the final polish. You have two polishing steps, and that's it. I mean, how more simplified can you get? And that's our final restoration at MOD on tooth number 13 using A3 bulk fill shade. A nice end result in something which is kind of a daunting task, but predictable time and time again with the proper materials and the proper equipment. Now here's where we're going to kind of move ahead here a little bit to some of the newer products that are on the marketplace right now that, once again, the innovation that Garrison has shown with some of these products really exemplifies their status in the industry as far as I'm concerned. The ability to create these and offer an improvement over what we have and offer something really improves our dentistry. So this is the fusion wedge, which is really a neat little product if you look at it. It has 4 different sizes, and you can see here, I'll show you what it is. It's got silicone feet that extend out on the sides, and you'll see it in place. It's got kind of a hard core in the middle, but allows, when you place it in there, these little silicone extensions, or the feet, does 2 things. One, you do not traumatize the papilla when you place it and remove it. And secondly, because of the nature of the material, it holds that matrix in place. Does not move, does not shift, does a much better job of creating that seal and contact and on that matrix, and you don't get slippage and movement. So now you have something, once you place that matrix, you hold it in place, put on this 3D wedge, and it stays. It's really easy to place. It kind of glides interproximal there, easy to place and easy to remove. And that just kind of gives you some of the rationale behind the introduction of this. And once again, it's just a neat little product that makes a big difference in the placement of Class II, Class 6 restorations that we haven't had before. And once we place that in, that cervical seal is completely occluded. Now we have a really tremendous opportunity to go ahead and completely eliminate any overextensions in the cervical areas because of this wedging effect, because of the thin matrix, because it's impossible to go ahead and finish composite down that cervical area. You cannot get in there. So you have to establish that ahead of time. If you do that and you have nice interproximal morphology and laterally, you don't have all the time finishing and polishing. It's just really on the occlusal surface, and that's the way it should be. And here's just an example of it in place on tooth number 13 there. And doing an MO there, we've already placed it, and you can see the matrix in place, how well it holds that in there, and still has a tendency to go ahead and gain the ability to separate from the mesial tooth there on tooth number 12. So now we're going to establish a really nice interproximal contact. You can see what we end up with, how sincere that contact is. And notice there's no trauma to the papilla. These glide in so easily, and due to the nature of the surface, you don't traumatize the papilla. So you don't get the bleeding, you don't get the hemorrhaging you're dealing with when you get into finishing and polishing and ongoing inflammation for the patient. Much less traumatic, and does a really good job of holding that matrix in place. Once again, this is an example of a bulk fill restoration that you're seeing. And here's another example, just kind of showing it in place here. We always place our wedge in from the greatest access area, from the greatest area, the greatest space in between the teeth. There's always one area, either buccal or lingual, that has a little bit wider spacing. And that's where you would go ahead and initiate the placement of your wedge. So maybe from the buccal or maybe from the lingual. Now we go ahead and we place, once again, we place our matrix. We've placed, just to show this, we placed our matrix. We've placed our wedge after that. We've centered it where we want to. We burnished the matrix that you can see there. We placed our 3D XR from the mesial. And now look at that beautiful contact that we're going to end up with based on the use of that material and equipment. And now we're going to go ahead and do the finishing and polishing. Now, these are the addition to the polishing line I really like. These are the ones that are autoclavable. The yellow one, or the tan one, is impregnated with aluminous oxide. I mean, we know 3M is an abrasion company. They have been. And then the purple one is impregnated with diamond paste. So now we end up with this just unbelievable polish to the Filtech material, something that lasts. They've shown that luster lasts. So now we're going to go ahead and we went through the 2 steps with the 15 fluted and 30 fluted carbide from Brasser using electric handpiece. We're now taking our spiral polishes, the tan and the purple, 5,000 RPM for 30 seconds with water spray. Now the other thing you have to be careful with these is that if you get them too close to the lips or the cheek, they may have a tendency to engage some of the epithelium or mucosa. So make sure you have the lips and the cheeks retracted. But it just does a wonderful job there. You can see the finish and polish of that restoration and the enviable contact. And notice the lack of of any type of hemorrhaging from the interdental papilla. And now we'll finish out at least as part of it, and getting close to the end here, and want to entertain some questions. Once again, as I mentioned, Garrison is unbelievable what they can go ahead and produce and introduce to the marketplace, and these little things that add up to be big things. We've talked about some of the other things. Well, this is their new addition, this 3D fusion wedge. It's a little bit different configuration, a little bit stiffer, and you can see it's got a little bit more of a circular flow to it. So now we can really go ahead and capture and captivate these restorations, especially larger ones, and not have to worry about the flare, the excess composite being an issue. And once again, it's got this non-stick matrix, which it comes in 5 different sizes, and some have some cervical extension if you have some deeper caries. So this really, they're a little bit more rigid, they're easier to place, they stay in place better, and they grab around the tooth better and capture that anatomy better. So now, and here's just the kit in place, and they got that little tab too, which aids in, if you want to put that in the interproximal ridge, the adjacent one, or for removal, really aids from that standpoint. And here's a situation where this really is ideal. And a carious lesion on the mesial number 14, you'd be surprised what you get into all of a sudden when you remove the caries and the unsupported enamel and the carious dentin. Also ending up with this really large restoration. Yeah, could probably use a crown, but being the economy the way it is, this is ideal. And I showed this shot before we put the ring on. Look how well that has a tendency to go ahead and capture the anatomy, buccal and lingual, because of the curvature of that. This very, very large MO. It's extremely large. But now we're able to do it with this matrix, and once we place that wedge in, it stays in place. It doesn't move. And we have the nice interproximal contact there, and we're finished. No overextensions to finish. The cervical has been completely prepared and placed properly, so we don't have overextensions, and we end up with this beautiful restoration, which will be easier for the patient to clean and allow them the use of that tooth for a long period of time, maybe even without having to have a complete coverage zirconium or Emax crown placed. Just to show you here, just to kind of reiterate what before we finish here the Q&A, I wanted to show you what the particular numbers of these products are from Brassler that you can use for finishing. And I kind of went through a lot of effort to figure this out and simplify it. And here's a look from the lateral view. On the right are the 2 spiral finishing wheels from 3M Oral Care, and on the left are the 15 and 30 fluted carbide burrs from Brassler. Their numbers are there. You can write them down. As I mentioned, I think the design of these and the configuration is ideal for doing any type of restoration you want. And to me, it just really simplifies it. Electric handpiece, 1 step, 2 steps is all you need. 2 steps for polishing, you're done. Use the right materials, the right matrix, the adhesive, and do this. I'll tell you, you'll just end up time and time again being very happy and proud of your work, having success, patient being happy, no post-operative issues. And to me, it's just a really enjoyable time to be doing this kind of dentistry because of all these products coming together. So my mission here has been hopefully giving you some insight into the latest, best products for our restorative dentistry when we talk about doing posterior composites, and how you can benefit from the utilization of all these particular composites, adhesive, and matrix finishing systems on the marketplace, and really enjoy doing these procedures and making it profitable for you too. I'm now going to go ahead and that's my contact information, and in a minute here I'm going to turn it over to Kevin. He wants to say a few things, and then I'm going to be taking a look at some of the Q&A and then get back to you on that and finish the evening off with any help I can offer you. Thank you.
Well, hey, thanks, Dr. Braun. We really appreciate your effort here this evening and good information there. So while Brian and Dr. Braun coordinate the questions that have been submitted, one of the features here this evening is for those folks who registered for this webinar, The kit that Dr. Braun showed you of the Garrison Composite-TIght 3D product with the new Fusion bands and the new Fusion wedges, our top selling kit for that we're offering for $1 for you to try it in your office for 60 days. So if you follow the link there later on in the next day or two, you can go to that special page. The information is there as far as the details of how that works, but essentially you got 60 days to give the product a good work over, try those techniques in your office, and hopefully have wonderful success with that. So, and then if you do happen to call in, you want to make sure that you use the promo code that's listed there, ONBLUE 0816, and that lets the folks on the phone know that you took part in the webinar, and they will be able to make that offer for you. So it is limited time. You only have a couple of weeks in which to take advantage of that. So Brian and Dr. Braun, did you guys have a couple seconds to get those questions organized?
Hi, Kevin. Can you hear me okay?
Yes, I can.
I have two options. I can read the questions that have come in to Dr. Braun, or we can stall for a moment and I can bring up the slide. Dr. Braun, would it be okay if I read 5 or 6 questions that have been submitted?
Yeah, why don't you just read maybe a couple, just depends on the length of the article. We'll try to get through a few. Give me 1 or 2 at a time here, and then if that's best, we'll just go from there.
Okay. Question number 1, is it a bad idea to place matrix, then bond? To place the matrix and then place your bonding agent?
No, it's not a bad idea at all. There's no problem at all. The adhesive will not stick to the non-stick Garrison matrix. The advantage of not placing it in ahead of time, you just have a little better access as far as you know, seeing where the walls of the preparation are. But as far as procedurally, no, it gives you a little bit more isolation when you put the matrix band in there. As long as you don't create any hemorrhaging, there's no problem whatsoever. Sometimes the matrix band, you know, unless you've gone through all the wedging and everything else, maybe move a little bit ahead of time. I generally like to go ahead, as long as I have access, I will place the adhesive first. If I have a little some interdental papilla deal, I may put a cord in for a minute, remove it. I like to go ahead and place the adhesive first, and then go ahead and place my matrix, because you know, you may inadvertently go ahead and create some hemorrhaging and contaminate the field. That's the only rationale. You know, I've done it both ways. It's not really that critical issue. The more cervical you get, maybe the more issue of tissue impingement may be, and that may be indication to go ahead and place a matrix in. So either way is acceptable. The main thing is trying to keep the field as clean and non-contaminated as possible with either saliva, use of rubber dam, or some type of cord, and eliminate saliva and hemorrhaging being in the composition when we place our adhesive.
Thanks. The next question for you. What would you say is the #1 benefit of a sectional matrix system versus Tafelmeyer?
Well, the purpose tonight is really to showcase the use of sectional matrix. If you think about a placement of a circular band around a tooth, which is not circular whatsoever, it's more oblong, trying to go ahead and close that space in with the Tafelmeyer does not allow you to, does two things. One, you do not have the proper morphology interproximally, because it's a different type of shape. You don't have the ability to follow the morphology of the tooth, and you end up with excessive placement of composite, excessive materials being an issue, more finishing and polishing, improper contours and anatomy, and secondly is allowing the sincere cervical wedging that can take that you want to get with the sectional matrix to ensure the homogeneous seal of that cervical area, and that can only really be done with the cervical matrix for the rationale that I mentioned. Having a circumferential matrix doesn't allow you that sincere adaptation, both from a occlusal interproximal area all the way down to the cervical area. So the potential for voids and improprieties are, in my estimation, greatly enhanced when you have some type of circumferential like Toffmeyer. You know, obviously it becomes less of an issue if you have a smaller restoration to deal with. You know, usually a lot of times replacement amalgams are much larger. So the sectional matrix just gives you a much better potential for interproximal contact, much better sealing of the cervical area, and less finishing and polishing to do interproximal as you flare out.
So another question along the same vein as this. Then there's some on a variety of topics, Dr. Braun. So the third question is, can using sectional matrices reduce retreatment?
Well, it depends why you had to retreat the tooth. The main reason for, within the first 5 years, I mentioned the first reason for replacement of tooth is fracture. That can get back to various reasons, occlusion, the type of material used. Beyond that, it's usually current caries, and that gets back to the adhesive phase. You know, how well did you establish that hybrid layer? A sincere reduction and elimination of micro leakage is certainly important. And the more important, I guess, the more critical issue that you would face, at least initially, I would say they've done studies within the first week, no matter what type of restoration, the patient's always going to have some initial post-operative hyperalgia. In other words, cold, sweets, air, maybe occlusal contact on that restoration, maybe a little bit uncomfortable. After that, there's a problem. If there's a problem with post-operative sensitivity with composites, it's because, as I mentioned, this hybrid layer has not been formed properly. So that the only way you'd eliminate that is to retreat the tooth, having to take out the composite, getting back down to the dentinal surface and restarting. So the sectional matrix is not so much in the adhesive phase as it is in the overall configuration and placement of the final composite material. So the adhesive phase is a little bit different, creating problems as far as post-operative sensitivity.
Okay. A few more have come in specific to the matrix system. What band would you use for primary molars?
I don't treat kids, but maybe Kev can fill you in on that.
Short ones. That's
yeah, exactly. My point exactly. The matrix kits usually have like 5 or 6 different sizes from molars, premolars, and they also have some cervical extensions in case you have a deep caries interproximal. So I don't have a good answer as far as the primary teeth. I know some of the earlier systems had even some smaller bands, and that may be something in small rings, which were easy to go ahead and place, and smaller in diameter and probably less cumbersome from that standpoint. So that may be something to look into.
Yeah, they do. We still do have the true, what we call a pedo sectional band. It's not in any of the kits. It's a separate item. It's kind of a specialty type band. That's why it's not in the kits. But the blue rings work really well on pedo teeth because of their gripping ability. And you couple that with the true pedo band, and you're in business.
So 2 questions around the wedge system itself. So if you could answer both of these. So it's how do you decide what the ideal wedge size is? And very similar to that is, can the wedge system be used with a rubber dam, as the rubber dam is isolating a specific area?
Yes, you can use it with the rubber dam. You saw some of those with the rubber dam, some without, depending on what I'm doing. If you're near the parotid gland, Stenson's duct, if you're in the floor or the mouth and you have problems with saliva control and containment, obviously a rubber dam is great from that standpoint. Placed rubber dam will not interfere with any of the wedge placements whatsoever. As far as the sizes, there's 4 sizes in the new ones, and depending where what's can you do? Are you doing a premolar? Are you doing a molar? How much is there been any periodontal loss? How much is the soft tissue impinging on what you're doing, and how large is the restoration? So, usually, and sometimes they have like small, medium, large, and extra large, whatever. You'll have to kind of gauge it just depending. Obviously, the ones we use the most are the ones that are kind of the intermediary ones. You may find out sometimes that you may have a little, greater interproximal space in between the two. You may want to use a larger wedge. So that time, a lot of it has to do with experience. I mean, there's some designations on the matrix and on the wedges too, but you want to get a very sincere, wedging effect to that. So you want to push that thing in and use good amount of force, not just going to slide in and lay there. You'll feel that you're really wedging the teeth apart. And once you've used this for a few times, you get a sense of which ones work best in what areas and for what reasons.
Okay, Kevin, I have one for you. A dentist asked, I want to know why the dollar deal doesn't work for Canadian dentists.
Oh, that's a good point. Well, in the U.S., we sell both through the dealers and direct to the dentists. In Canada, it is strictly through the dealers. So unfortunately, it's kind of one of those, the deal's too good to be true, and the dealers don't necessarily want to take part of that. So, but we're happy to ship it to a U.S. address if you can get it up to yourself.
I think another question for you, Kevin. Why doesn't your kit have the Composi-TIght 3D fusion wedges?
It does. The kit, the dollar kit has both the fusion wedges and the fusion bands in it.
Got another one for you. Do we get CE credit for this event?
Unfortunately, not this time around. We don't have the authorization to be able to provide CE credit.
Dr. Braun,
Yes, still here.
does the silicone face of the Garrison ring make that much of a difference compared to other separator rings on the market? And I can read that again if you'd like.
Yeah, no, I tell you, it's supple, but it's very strong and very supportive, and it compresses enough. So the overall design of these rings, the XDR especially, and it's so taut. Other ones that I've used, I've never seen anything as grip and fill in the interproximal as well as these do. And there's a lot of other matrix systems out there, but I've been extremely pleased and satisfied with this, and not having any problems of improper contours, any excessive composite being expelled or expressed, because of the ability for that wedge to take place in between the teeth with that ring and really offer maximum stabilization of the matrix, and seems to fit in every case I've ever done without any problem. Now you may have some issues with rotation, and there's some different rings for that they have, but for routine cases, this really is a very sincere stabilization of that matrix, and really it's the matrix that creates the contours, and it's the ring that keeps everything held together, and the wedge keeps that matrix from moving, and with the new one it also seals off that cervical. And to me, that's something we absolutely need to have doing composite dentistry, not worrying that we have overextensions or overhangs that we cannot really eliminate.
And this question was asked, it goes in line with what you just stated. What are the easiest ways to adjust an interproximal contact that is too tight for flossing?
Well, there's not a problem at all. There's all sorts of different saws and bands and finishing strips that you can place in there, and you can with these. Obviously, if you wedge it too taut, you can end up with interproximal contacts that you can't get the floss through. In that case, the best thing to do is get one of these finishing strips. You put a wedge back in to separate the teeth, and go ahead and adjust the interproximal contact with some type of a finishing strip or whatever. There's also some saws, but that just really more like for when you're placing porcelain laminate veneers if you bond surfaces together. But that really the best thing to do is wedge it, get some finishing strip, go from coarse to fine, and pull the wedge. I think you'll be fine.
Great.
Quick note here, Brian. I just got a message from one of our folks at the office who is listening in, and they said to call in the morning the toll-free number that's listed there for the Canadian dentist, and we'll make sure that he or she gets that dollar deal. So if they call tomorrow from 8 a.m. to 5 p.m. Eastern Standard Time, we'll make sure they get it.
Good. Thanks for clarifying. Kev, this is for you. If I order the $1 deal, what are my options after 60 days?
Options are to return the kit, the unused portion. Obviously, we hope that you've used some bands and wedges in there, but return the the rings, the remaining bands and wedges, and the forceps, and we'll call it even. Or if you want to keep it, then we'll go forward and charge your credit card for the balance.
Great, that's clear. Question for you, Dr. Braun, on instruments. Have you found a trick to keep composite from sticking to instruments? Does alcohol work?
You're not supposed to really use alcohol. It may interfere with some of the properties. There is if you use a Garrison instrument, it's got that nickel plate on there. You won't get any stick with that. At least the composites we use, some of the composites are a little bit less viscous and they have a tendency to pull back a little bit. There is a material on the market. It's called lube, L-U-B-E, lube cube. And what it is, and I'm trying to think of the name of the manufacturer.
Centrix. Centrix makes that product.
Centrix. And what it has in it, it's a little sponge, and it's got a monomer in there. And all you have to do is dip your instrument in that before you compress your composites, and you won't get any pullback from it. So that's what I recommend. You're not supposed to use adhesive. You probably can use alcohol, but this lube cube works better than anything else.
Got it. Question I have: How do you like to round your marginal ridges? How do you like to round your marginal ridges?
Yeah, and that's once again, it's not like placing an amalgam. I think the main thing, and you don't want any necessarily overextensions or unsupported composites. When we talk about anatomy, we talk about something which is relatively just somewhat flat to a great degree, having good interproximal contact. But the fossa that normally we could get like with an amalgam, where you could get in there with carve it with a cleoid, discoid, or whatever. That's not really achievable with composites. What you want is just something which is at the proper interproximal level, have a slight dish tube, but not really a thin interproximal area in through there. I think you may potentially end up with a little chipping or fracturing from that standpoint. So the best thing to do is just get a really sincere placement, do your carving, make sure it's adjusted to the right height, and the interproximal ridge have to be a little bit different than normal what we would have with with our traditional composites. You can take a composite, or you can take an Explorer before you actually cure it, and that does a reasonable job of ending with that opening right there at the marginal ridge and getting a little bit of a roll to it. So there are some instruments that you can use. Ward's Carver works pretty well, but I don't go overboard. I just wanted something which is more functional, is going to hold up long term.
Okay. Is it necessary to turn off the LED light before placing a composite?
Yeah, you don't. You can, as long as you have the orange filter on, you have an indefinite amount of working time. And we did a program, I don't know, recently on use of dual cure cements, Unisem 2. Any material that's either a light cured or dual cured has a propensity for pre-polymerization if you get too intense light on it. So the LED with the orange filter placed will not set up your adhesive or your composites. So we keep the operatory light off the subject. We just use my LEDs with magnification with the orange filter. Once you've done your adhesive and composite, obviously you can open that up and get back to your regular balance to daylight 3-watt intensity. But during that other phase, keep it on there. The overhead ceiling lights aren't any problem whatsoever. But just give yourself enough time. And the LED's intensity with the orange filter, this 3-watt, is incredible. But the camphor quinone, which is in 95% of our adhesives and our composites, is activated by that 450 nanometers. Well, that orange light negates that wavelength from being expressed. So that's why you have unlimited working time when using that orange filter. So you have to do it. That's the bottom line. I've inadvertently, occasionally, be looking at something, putting something in. I forgot to put my orange filler. All of a sudden, things start to gel on you. So it's just a word of the wise. It's a great facet to have with your headset and necessity.
Dr. Braun, I see two more questions. The next one is the clear matrix better than the others?
The clear matrix, Garrison has got kind of a, I assume they're talking about posterior. I don't use any of the clear matrices for posterior. Garrison's got some nice and blue shaded ones that are great for, anteriors and interproximal areas, things like that. And they also have one that you can use for the posterior. It's a blue band. It's a blue shade. Maybe Kevin can kind of chime in on this.
Yeah, it's tougher to use. It's certainly not the first sectional matrix system you want to start with, because the matrix bands are more difficult to place. They're just, I guess the term would be fiddly. They're a little more fiddly. So. Yeah.
And you can't get the design you can with these metal-based ones.
No, you can't get the shapes.
Yeah, I stick with the matrices we showed tonight, the clear ones. Yeah, if you had something real small, it's fine, but you'll get complete polymerization using these metal ones. There's not a problem whatsoever. I can't see any reason why you'd want to use the clear matrix and not get the sincere, interproximal contact, the ability to design and place these things properly. So we don't use it for the posterior.
Okay. More complex question for you. Can we use this system for more complex restorations like MOB cavities or large proximal cavities?
Yes, you can. But what I'd mentioned that before too, if you have large interproximal areas, or maybe even no interproximal contact, whatever, or perhaps rotated teeth or large restorations, sometimes you're forced to use some type of circumferential matrix for various reasons. Garrison's got a real matrix, which kind of like is a remnant of a Tafelmayer type that's more or less like a disposable one, and one you can use with your Tafelmayer. So if you have these really large restorations where some of these facets and issues that I mentioned that are normally critical, you may have to opt to use some other type of matrix system to ensure the adequate placement of this material because of the design and anatomy of that restoration. But for 95% of the cases that we do, the matrices we showed tonight work out just dandy. There are cases where we have unusual tooth position that, or maybe due to the location or size of the restoration, that the only way you're going to solve it is to use some type of alternate matrix system. And Garrison's got them all too in various forms, right, Kevin?
Yeah. They there's all kinds of them out on the website, from plain Tafelmayer bands with the slick band coating to, like you said, the real matrix is a retainerless circumferential band. Very handy for those types of cases, because you're right there. When it gets to a certain width, there's just nothing to support the ring with anymore.
Right.
And a last easy question for Kevin. When does the promotion expire? How much time do they have to make up their mind whether they want the $1 deal?
They have until October 15th, so it's limited time, and we're limiting it to the first 150 folks as well. So.
And that is the last major question I have.
Well, we'd like to say a big thanks to Dr. Braun this evening for leading our session, and certainly some very good information that he shared with all of us. I always enjoy listening to him because I pick up a little bit more every time I get a chance to hear him. So it's very beneficial for me as well.
Thank you. It's been my pleasure.
Great. Well, thanks everybody for joining us this evening.